Male stvari.
Zdravo živo! Hype televizija je stigla u Sarajevo i danas ćemo da vam pokažemo kako stvarno izgleda proces vantelesne oplodnje i kako to nastaje jedan novi život, ono što se nekada zvalo dete iz epruvete, odnosno u laboratorijskim uslovima ili ono što se zove asistirana trudnoća ili vantelesna oplodnja ili na engleskom IVF. Sa nama je doktor Ali Mesut. Bolje vas našli. Hvala što ste nas pozvali u vašu kliniku Bonadea i što ćete našim gledalcima baš potanko da objasnite ovaj fenomenalan proces. Let us see where you work.
Yes.
Yeah.
This is our waiting.
So, while we are walking, can you tell me what brings you to Sarajevo?
Actually, I came here for 15 days. I'm living here for 10 years.
Well, that's great for all the people from here who are trying to get their children. So, okay, here is the laboratory.
Yes, here's the blood laboratory, hormone laboratory, and we have machines here that we are doing this.
And here are some of the babies.
Babies that from the old photos from the...
Some of 10,000 babies, yeah?
Yes.
Male stvari.
Ekipa Hype televizije stigla je u Sarajevo u Bonadea kliniku za vantelesnu oplodnju da se uverimo zbog čega pacijenti iz čitavog regiona biraju baš doktora Alija Masuta koji je 2018. došao u ovaj grad na 15 dana i odlučio da tu ostane. Tako da ćemo u ovom intervjuu u stvari da probamo da uđemo u te tajne začeća posredovanog, kako se to kaže, odnosno samog procesa vantelesne oplodnje, gde ćemo ne samo da porazgovaramo sa doktorom, nego i sa njegovom partnerkom, koleginicom i suprugom koja se upravo bavi embriologijom, pa ćemo vam pokazati i kako zapravo stvarno fizički izgleda taj proces vantelesne oplodnje. Naravno, to će biti maketa, nećemo ugrožavati ničiji genetski materijal, niti bilo čiju privatnost. Dr. Ali, thank you for having us here in your clinic.
Thank you for coming here. I'm so glad to see you here.
Yes. Samo da kažem da je dr. Ali specijalista ginekologije i akušerstva, ali da je naročito specijalizovan za vantelesnu oplodnju. So you have a big contribution to the world natality, especially the West Balkans natality, yes?
In Balkan, of course, it's not a number like this, but I generally, totally that I'm talking about this because from 97, I used to work very hard in this job. And I'm one of the pioneers of the IVF in Turkey, actually. And from that time, we are working for this.
Yeah. You worked in Turkey for a German hospital?
Yeah, I used to work. I started in the international hospital as a fellow. And then in the German hospital, Universal Hospital, I started my practice there. And my first IVF baby born in 97, twins.
So how was it? How was the feeling?
First, Actually, this is really excited. And when we had a pregnancy positive test, I used to write what's the name and how is this and how many of them is getting pregnant. So at the beginning, was very excited, but after then, actually, this is the
You couldn't follow all of them.
I couldn't follow. This is life.
Do they call you today and say, hey, doctor, I was just, born because of your help?
Yes. Actually, now, around 1 year before, one of my patients said that my son has the same problem that I had it. And I want to do the IVF where I said, no, I'm working there. Sarajevo, Bosnia. So I'm not in Turkey, but of course I have a good friends, I have a good colleagues over there. So I said they can start. Now second generation also, they are looking for the
Yeah.
I hear from them.
So, in your experience, what are the most frequent causes of infertility in men and in women?
Actually, when we started this job, at that moment, mostly because of the tubal factor, ovulation, and ovarian factors. But nowadays, we have a problem with the aging of the woman.
Of the woman?
Because they are starting for their life, for making either child or parenthood, to be parenthood very late in their life. And they are marrying very late. And so now we have a big problem with the ovarian reserve. This is how many eggs we can retrieve from the patient. And second is with the quality of the egg because of the age. And
So, what is the problem with aging? Is it the stress that we pass through lives, or
actually, all the patients
illnesses?
talking, all the patients talking that about the stress, but all the research is showing there is no effect of the stress in the fertility. Maybe fertility is the infertility when they are not getting pregnant. This is making the stress for them. Not stress is making fertility, but this is making.
No, but I mean the quality of the egg itself. Is it influenced by some disease that woman passes, by pollution, or by what she eats?
This is the nature of the woman. This is the nature of the woman. For example, one baby girl is born in around, we fixed number around 2 millions of the eggs. When the baby is born, this is around 2 million eggs in the ovary. But when they are coming, the adolescent, when they are getting puberty, first menarche, they have around 400,000. And when they are coming in the 35 or 25,000, and when they are going to the menopause, around 1,000 in the ovary. So with the time, this is a declining.
No matter how many cycles they had.
No.
So it just reduces naturally.
Yes, it's starting. For example, each month when they are young, each month around, for example, 100 eggs is preparing for ovulation. Just one is winning this and is going to the ovulation. The others are dying and absorbing with the body. So from these 400,000 that in the puberty, just they are using 400 of this. Just 400. The others are dying. So when the patient is getting older, the numbers of the eggs is reducing, and also the quality. What is the quality? There's many genetically abnormality, chromosomal abnormality in the remaining of the egg. So after 40, generally egg quality is not good, or if they get pregnant, they have a Down syndrome, Turner, different type of this. This is because of the egg quality. Egg quality, there's a disjunction. The chromosomes are not separating correctly.
Yes, there are also new researches that show that the sperm is also getting worse with aging.
Men are not like the woman. They're fertile they are more fertile than the women. For example, everybody knows about the Charlie Chaplin. At the 80, he got the baby. So
Picasso also got a lot of children in his older age.
Yeah, the men's, yes, they are producing the sperm, but of course, the quality of the sperm, they're getting poorer than before. For example, after 50 or something, the quality of the sperm is not like as when they was in the 25 or something.
But is there risk for malformation? Or is it just the problem of getting pregnant?
Generally, body is selecting. If there is a malformation, generally body is rejecting this. And it's not going to the pregnancy, or they are doing the abortion, or after that, when the baby is coming in the 11 weeks or something, we are doing the NIPT test. That's for the genetics of the baby. Or with the ultrasound, somehow we can find it. Generally, it's not making any problem for this, but of course, actually at the last publication or something, autism, something is depend to the age of the man.
Age of the man influences autism and such
Yeah.
kind of malformation.
Something that we cannot say 100%,
Da.
but maybe it's because of when they are getting older, it's making like these problems.
So, do you have? We will come back, of course, to the fertility. But do you have older couples now, like older man with his new wife, or because now we can see in the society there are a lot of divorces and a lot of new starts, especially for men.
And actually, when the woman is young, the possibility to get pregnant and healthy delivery is too high. They are getting pregnant.
So they don't need your help.
This is it. But of course, we have to be careful for the man. If they need to do some things also, we have to check to see for the sperm quality also.
So you can check the sperm quality.
Yeah.
Not only the speed. Yeah. What else can you check?
Generally, in the laboratory, what we are doing, when we are doing the IVF, we are selecting the best sperm. How is going? We are making the magnification 600 times bigger than this. So we can see the glava, ribs, the head, the neck, the tail, chromosome, cytoplasm, everything. We are checking for these are also in the laboratory, and we are trying to select the best one. Of course, at the beginning, we are selecting the sperm that have a good motility, good shape. But after that, again, we are checking for the under the microscope to see how it's looking.
So here you have some needles.
Yeah.
So show us so that we know how you actually do the assisted pregnancy.
Actually,
How small these organs are.
Naturally, this is the ovaries. Yaynik.
Jajnici.
These are the yayavoda fallopian tubes. This is the vagina. This is the cervix or girlich.
Can you just move it?
Like this.
Uh-huh.
Okay. This is the vagina. This is the
Cervix.
cervix. This is the uterus. This is the endometrium. This part of the uterus is the most important part of the uterus. And if it is not good, if it is not suitable for pregnancy, actually we cannot expect any pregnancy. If you have a best embryo also, if here is not ready, it's not possible to go to the pregnancy. So naturally, after the intercourse, sperm is coming, I will show you this. Sperm is coming in the vagina, then it's going through the cervix, going to the uterus, and following here, coming to the yayavoda. This is the ampullar part of the tube, fallopian tube. Here is a place that egg and sperm joining each other. And then, again, starting to the journey to the uterus. And it's coming here and making the pregnancy and continuing. If it is,
And the embryo is being stuck to the endometrium.
yes, implanting in the endometrium around 5th day of the ovulation.
5th day.
Yes.
After.
Yeah. It's coming like this. If there is a problem with these tubes, if sperm cannot go there, if the egg cannot come inside the uterus, or if there is no ovulation here, if there is no good endometrium or is not possible to support the embryo here, or if there is a problem here in the cervix of the patient, or if there's a problem with the sperm, at that time we are doing the IVF. What we are doing, we are trying to retrieve the egg from the ovary,
Okay.
a sperm with the man. If it is ejaculated, okay, we can take from the ejaculate. If no, from the testis, we are cutting testis, we are opening the testis, we are finding the sperm from the testis of the man. Then we are making this joint that they are here, they are joining each other. We are doing.
So you put it through the needle.
Yes. When we find the egg, after that, We are doing the microinjection. The microinjection, yes.
Yes.
This is the
Actually, you join sperm and egg outside of the body.
body.
That's why we call it Vantelesna.
Vantelesna.
Outside of the body.
Yeah.
And then you put it back to the woman's body.
After now, when the embryo is ready, we have a catheter here without any pain, anything. With this catheter, we are coming from the cervix and just pushing the embryo here. We are putting embryo inside the uterus
And pray to God.
Praying to God to get pregnant.
It gets into the endometrium. So let me show you epruveta.
Okay.
In the past, it was called dete iz epruveta.
Yeah,
you know
epruveta.
that?
Yes, I know
You know that?
epruveta, yes.
So this is epruveta.
Male stvari.
Sad ćete da vidite kako izgleda srce jedne klinike za vantelesnu oplodnju. Sa mnom je doktorka Nursen Mesut, embriolog. Hello.
Yeah, hello, hi.
Thank
how
you for
are you?
having
Very
us
nice.
here.
Thank you for coming and visiting our laboratory and our clinic. Thank you. The
Znači, ovo je
sperms-
muški deo.
Yeah, the mans that they put their sperms in the boxes, again sterile, and we take these boxes and do procedure and purification here, and the centrifugation, and this is the incubator. This part is all andrology, and when the sperm is ready, we are putting in the dishes like this. Like this.
Nakon aspiracije folikula provjeravamo u susjednoj laboratoriji folikularnu tečnost. U toj folikularnoj tečnosti pokušavamo...
Znači, to je kada iz jajnika izvadimo...
Jest. Znači, taj dan kada radimo aspiraciju jajnih ćelija, doktor je aspirirao folikule određenim uslovima i šalje to nama u laboratoriju. Mi embriolozi pod mikroskopom pokušavamo da pronađemo jajne ćelije koje kasnije prebacujemo u poseban medij i taj medij ostaje dalje u inkubator.
Dakle, ovdje sačuvamo jajne ćelije.
Ovdje sačuvamo jajne ćelije, mi ćemo ih kasnije prebaciti u inkubator da se one malo odmore. I za to vrijeme mi ćemo pripremiti spermatozoide.
Znači, ovdje se kombinuju, ovdje se stvara u stvari novi život.
This is the start of the life here, actually. Because the sperm that we purify over there and the eggs that we collect here, at the end, we combine them to become an embryo.
So do you put them in some kind of liquid and then they get
Actually,
together?
we put the eggs in the liquid, and there is sperms in a solution that a little slow down the movement. So to select them. To select them, because we put a lot of sperm here, millions maybe, and then we try to select the best one for the microinjection.
So you can see them through the microscope.
I break the tail to stop it.
To slow it.
Yeah, slow down and take in the...
Sad radimo zaleđivanje embriona. To radimo uz pomoću različite koncentracije medija, gdje se na određeno vrijeme embrioni ispiraju, onda se uzimaju i prebacuju se na slamčicu. Eto, toliko. I ova slamčica onda ide u azot na minus 196 stepeni. Isti dan, kada aspiriramo jajne ćelije, radimo spajanje, to jeste oplodnju. Sutradan, to zovemo dan prvi, možemo da vidimo oplodnju i nadalje pratimo svaki dan rast embriona. I na određen način mi taj rast zapisujemo. I u inkubatoru, u našim embriološkim uslovima je moguće da se prate embrioni do 6 dana za sada.
I posle se moraju zamrznuti, jel?
Jeste. Za mjesec ili dva mi ćemo u laboratoriji odlediti embrione, a doktor će pripremiti endometrij pacijentice za transfer. Sada punimo tečni azot u kojem ćemo zalediti naše embrione. Sada je došlo vrijeme da naše embrione, odnosno blastociste, zaledimo u ovisnosti na određeni dan. Koristimo različitu koncentraciju medija. Embrione stavljamo na slamčicu.
Ovdje nam treba detalj.
Tu su nam embrioni. I embrione ekspresno ubacujemo u tečni azot na minus 196 stepeni. I embrioni su spremni za svoj put u tank. Naše embrione skladištimo u posebne tankove gdje naši pacijenti dobivaju tačnu adresu i oni tu mogu biti nekoliko godina. Do narednog odleđivanja ili do naredne trudnoće.
To znači, to su oni embrioni koje nećemo sada da vratimo u matericu, je li tako? I tu ide da se zamrzne.
Jest.
Na minus
196
stepeni u tečni azot.
U tečnom azotu tankovi su povezani alarmnim sistemom gdje imamo posebne poklopce koji nam pokazuju uvijek temperaturu i koncentraciju, možda ovako da okrenem, temperaturu i koncentraciju tečnog azota.
Male stvari.
This is the actual size of the egg and of materica, and the ovaries. Okay, so you mentioned that if there is no ejaculation, you extract the sperm from testicles. So is it dangerous? Is it heavy operation?
This is one of the most important operation that we are doing in our center, or many of the centers is doing this. Generally, at the beginning of this job, when the sperm quality was, for example, around when conventional IVF is to put the sperm just around the egg and to wait to see the egg is getting fertilized or not. At that time, just until 90s, we used to do this.
In epruveto.
Yes, just egg is here, we are putting some sperm here. This is a conventional that Louis Brown actually born with this technology.
Who is born by that?
Louis Brown, that the first IVF baby in the world in 1978, and with this technology. But later we
it was some kind of competition, which sperm is the best.
Yes.
The same as in uterus. So the fastest and the most persistent, the strongest one actually passes through all these tubes and finds the egg.
Yes.
So that's why there are so many spermatozoids and so few eggs.
And when there is a low amount of the sperm, at that time there is nothing to do so. Later, when the microinjection is somehow one
developed.
Doctor, yes, and with the microinjection, so we solved many of these problems. But we came in the point that some patient there is no sperm in the ejaculate. So what to do with this patient? Generally, with the anesthesia, patient is with the anesthesia. We are opening the scrotum of the patient, and from the testis, opening the testis. Inside the testis, we are looking under the microscopic examination. It's a microtest. We are trying to find the sperm in the canals that he has. And we are making samples, sending the immediate in the laboratory. If there is a sperm, so we are using this or freezing this, and after that we can use it. Sometimes when there's a problem, yes, we are doing this operation. It takes a little long because sometimes it's hard to find the sperm.
Yes, the right one.
Yes.
The sane one.
Sometimes there is no sperm, so you have to dig everywhere to see where is the here, where is that.
But under the microscope, you can see the sperm.
Not sperm. We are looking for the tubes that there is a possibility to have a sperm inside. The tube that's looking good for that. And we are taking this, putting this, sending to the laboratory, and from inside these tubes, they are finding the sperm.
Yes, but before that, you make sure is the problem with the male or the female?
Yeah. First, we are checking for all the genetics of the man. We are checking for the hormones. We are checking for the ultrasound of the man. We are checking all of them. If it's suitable for this operation, yes, we are arranging for the microtest operation.
Yes.
Male stvari.
Sad ćemo da vam pokažemo kako radimo mikrotese. To je operacija kod muškaraca kad iz testisa pokušavamo da pronađemo spermatozoide. Pod ovim mikroskopom doktor gleda tubuluse u testisima, njih vadimo i ponovo šaljemo u embriološku laboratoriju gdje oni pod mikroskopom pokušavaju da nađu spermatozoide.
Sigurno ste čuli za takozvane histeroskopske metode, odnosno kada se uz pomoć neke male kamere uđe u unutrašnjost materice i onda se iz nje skloni da li imate polip, miom ili već bolje će nam reći stručnjaci iz klinike Bonadea. Na primjer, i kada dođete na Vantelesnu, pa kada se desi da žena ima nešto što mora da se ukloni, što bi ometalo da se plod...
Jeste, to se obično može vidjeti na ultrazvuk, ukoliko doktor primijeti da ima neki polip ili da mu je nešto sumnjivo, onda radimo histeroskopiju gdje sa ovom kamerom ulazimo u maternicu, dakle doktor preko kamere pregleda situaciju.
Dobro, znači ovo je kamera, je li tako?
Jeste, ovo je kamera.
Ovo je kamera i onda se projektuje tamo...
I sa ovim vrhom histeroskopa ulazimo u maternicu. Ukoliko postoji polip, onda je sa makazicama koje prevučemo kroz histeroskop.
Jel vidiš makazice? O, super, vidiš.
Jeste, i očistimo sve ono što smeta.
Znači ovdje na vrhu su praktično, je to sečivo, tu se odseče i onda se izvuče iz materice i ide tamo negdje na analizu, jel?
Jest, onda polip koji smo izvukli šaljemo na patologiju.
Da. Aha.
Yes, imamo i hvataljke ukoliko je nešto ostalo pa da se sve to fino izvuče.
Dobro, ovo su hvataljke.
Hvataljke, yes.
Aha, čekaj da vidimo, da kamera to primeti. Aha, so catch it. Aha, uhvati i izvuče. Wow, super. Ima još nešto što je za miome?
Jest, imamo i operativnu histeroskopiju gdje koristimo rezektoskop. To je ukoliko u mišiću maternice imamo miom, njega ne možemo odsjeći kao što je to sa polipom, onda imamo ovaj drugi dio.
Zašto? Zato što bi bilo mnogo krvarenja.
Jeste. Nemoguće ga je na taj način ukloniti. Onda imamo ovaj kao kauter gdje pomoću struje uradimo koagulaciju i odstranimo miom.
Also septum resection.
Da, ili ukoliko ima septum u maternici i njega radimo operativnom histeroskopiju.
Drugim rečima. Kako se još zove?
The more detail. If the uterus has a pad
zavaljena.
Kao pregrada u maternici.
Aha.
Like this, we are cutting them.
Jer kao maternica izgleda kao trokut, ako ovaj dio u sredini ide ovako, ta pregrada, septum, to skidamo.
Dobro. Znači, prolazi se kroz grlić materice i sve se to prati na monitorima.
Tako je.
Da, super. Nema čega da se plaše pacijenti. Kad im se kaže da mora nešto da se skloni, eto, ne brinite ništa. Vidjeli ste kako to može da izgleda.
Male stvari.
Do you make any hormonal stimulation for women before the egg extraction? And for men?
Yes, for the man and for the woman it's the same. Sometimes we are using hormone for the men also, because if there's a possibility to find the sperm from the testicle, we are starting to do some hormonal therapy, same, to a little to push, to boost the spermatogenesis, producing of the sperm. After that, we are doing the operation.
Which hormones do you give them?
Generally, this is gonadotropin, that hormones are naturally from the brain secreting, secreting to the stream of in the body. So generally, we are using these hormones for the pushing there. In the women, generally, as I said, ladies or women are producing 1 egg per month, and this is not enough for the IVF procedure.
Yes.
If you have more eggs, the patient has a more chance to have a good embryo, good chance for the pregnancy. So we are doing the stimulation. What is this? Starting the second half, the menstrual cycle, to use hormones that normally secreting from brain, but with the high doses. So in this case, ovary is starting to grow all the follicles that it has. So after that, we are arranging for the aspiration. We are retrieving the egg with the ultrasound, with the needle. We are going through the vagina.
So you take it out with the
Yes.
needle.
From the vagina, we have ultrasonic guided. One needle is going to the follicle. There's the follicles. Inside each follicle, there's the one egg. With the needle, we are going inside the follicle, aspirating that egg. It's coming to the laboratory. From the blood, from the fluid of the follicle, they are finding the egg. After that process is going on.
Then the process we will see.
Male stvari.
Sada ćemo da vidimo kako se to vrši aspiracija jajne ćelije. Mubina, hoćeš ti da nam pomogneš?
Može. Naravno, u ovoj operacionoj sali radimo aspiraciju folikula, odnosno vađenje jajnih ćelija. Nakon što doktor na osnovu ultrazvučnog pregleda i hormona utvrdi da su folikule spremne za aspiraciju, zakazujemo je i radimo u ovoj sali. Ovaj postupak se radi pod totalnom anestezijom, dakle pacijenti spavaju, tako da je za njih cijeli ovaj postupak potpuno bezbolan. Aspiracija se radi pomoću ultrazvučne sonde na koju imamo ovaj vodič za iglu. Igla se samo provuče kroz sondu i pomoću nje aspiriramo tečnost iz folikule. Ta tečnost dolazi...
Znači, praktično je uvučemo. Kad kažeš aspiriramo, kao izvučemo, kao špricem.
Jeste. Doktor, pomoću ovog aparata...
Jel se to ulazi vaginalno?
Da. Ovo je
znači ne ide se kroz stomak?
Ne. Samo ovo je ultrazvučna vaginalna sonda i samo se provuče igla.
Znači, s pomoću ultrazvuka mi znamo da smo došli do jajnika.
Tako je, doktor na ultrazvuku prati folikule i kuda igla prolazi i na taj način radimo aspiraciju. Pomoć ovog aparata ta tečnost prolazi u epruvetu koju dalje šaljemo u embriološku laboratoriju gdje oni iz ove tečnosti pod mikroskopom traže jajne ćelije.
Male stvari.
How much possibility there is when you do the assisted pregnancy to make it work?
Yeah. This is a good question, really good question. As I said, it depends to the age. Age of the patient is the most predictor factor of the IVF success.
So let's now talk about what age. You mentioned age before.
Under 35, more than 60%, 70% of getting pregnant in the first trial. I'm talking about the first trial. After the 35, the pregnancy rate is a little going down. After 40, declining a little rapidly. After 44, honestly, it's difficult to have a good egg with a good quality and to do the IVF. Because after 44, it's better to use the other technique like the donation or adoption is the best for that.
Yes, but if a woman has her own eggs or embryo frozen before, she can still use it even if she is older, yeah?
Of course. It depends on the age of the embryo when you retrieve this. For example, I had one patient in Istanbul. She came for that I have a menopause problem. When I checked the file, I said, you have many embryos here. Why you didn't try it? She said, I forget it. Maybe 10 years before. She said, I forget it. I said, you have a good embryo, so if you want, we can arrange for the embryo. But she said, I'm in the menopause. Menopause is not changing nothing. So, because with the hormone, just we can prepare the endometrium that's needed for the implantation. And if patients, the 50 also. When you prepare the endometrium with the hormones, so it's a suitable place for the embryo, and you can do the transfer without any problem. And if there's the embryos from the many years before. So they are healthy and easily they are going to the pregnancy.
That's great. Also one endocrinologist, very famous one from Serbia, she told me that women in menopause can also have pregnancy only if they have embryos or eggs frozen before. But how about egg itself? If she didn't have embryo but only her eggs, and now she wants IVF?
At which age we are talking?
If she has frozen as a younger woman, like 30, 35.
Yes, this is the fertility preservation. Fertility preservation, in some countries is forbidden, in some countries they are doing this. For example,
fertility
preservation.
Aha, okay. To je zamrzavanje jajnih ćelija, praktično kod nas se tako zove.
Fertility for men or for women also. For example, if the patient is under 35 and they want to postpone their pregnancy or make it to get parent, I don't know, after that, many years later, so they are going to the IVF center, just we are retrieving the egg, we are freezing the egg. When she married, I don't know, 10 years later, and we can use that eggs. This is a social egg freezing. But sometimes it's needed for example, the patient that they are going for the cancer operation or they are going for the therapy for the cancer. Before they going to the procedure, because this chemotherapy is making the problem for the eggs, and before the chemotherapy or before the removing the egg or something, to do the egg freezing.
Okay. So the eggs are also, they can live and they can be fertile. Because long time ago when I did one program on IVF, the doctor told me that embryos are more vital as the years pass than the egg itself.
Honestly, yes. Many years before it was been like this. But now, the technology that we are freezing the eggs, the possibility is good, but still is not like as the embryo. Embryo is surviving better than the eggs.
So how many years can the embryo wait for the implantation?
For whole life. They can stay when they are in the tank under the 198 degrees. So they can stay for a whole life. When you want many patients in the United States, for example, they are donating their embryos for the other patients because actually,
they don't need them.
Yes,
anymore.
They don't need it.
So how many degrees is the temperature of freezing embryos?
Minus 198.
And then when you want to do the IVF, what do you do with them? How do you unfreeze them?
Yeah, we are using the process of the thawing or warming the egg step by step, because egg inside the egg or embryo there's a water. If you want to freeze the immediately, making crystals and making it damage for them. So this process. First, we are taking the water from the embryo or egg. After that, when it's collapsed, we can freeze it. And then this procedure is going the opposite.
Going back, so you put the water back.
Yes.
Oh, so can we say actually the embryo is also life?
Yes, of course.
It's life.
This is the ethics of the embryo.
Yes, sure.
Nobody can talk about this because, yes, embryo
because it's oplođena jajna ćelija, embryon.
When somebody is coming here, I want to destroy my embryo, I'm like this, no, please, to use it or somebody to do this. Actually, this is one of the ethics of the embryo that nowadays we are talking about this, because in many of the countries, there's many embryos that nobody wants to use it, nobody donate for this research, and still they have full of the embryos staying in the tanks.
Actually, for the couples who cannot have children and who are both, for example, infertile, it would be a great thing.
Yeah.
So actually it would be a great thing to donate your embryo.
Yeah,
But it should be done probably anonymously, yeah?
Yes, there is many rules for this. Actually, because of the religion, some religion is not permitting this. So there is many things that governments are deciding for this. Churches are deciding about this. I don't know, lawyers are talking about this. Many things that in the countries with, if they want to decide about this, they have to make a rule. It's not like this to give from this patient to the other
Yeah,
patient.
so yeah,
Exactly.
normally there are banks,
Yes.
as there are banks of sperm and
Yes,
eggs,
yes,
yeah?
yes.
When you want to have a donation. Is there a bank for embryos?
And not honestly, because they are some of these embryos. This is not for bank. But
So somebody
I mean,
cannot say, I want to donate my embryos to the bank.
no,
Not yet.
honestly, they have embryos that's frozen. But if somebody wants to donate, for example, for research or for the donation or to destroy, they have to go to the IVF center and to sign a contract that yes, I decided to destroy my embryo, or I'm donating this for the other patient that's I know this or something, or for the research I want to give to for the research.
But it's not possible to give it to someone you know. By,
It's possible.
is it
It's
legal?
possible. Legal.
Here in Bosnia?
No.
Here
in
not?
Bosnia, we haven't anything illegal. Yeah, we have to do the in the Bosnia. There is no sperm donation. There is no surrogacy. There is no
Egg donation.
egg donation.
So you can only like...
Use just the husband and woman and uterus of the lady. Because as I said, endometrium sometimes, or when they have a hysterectomy, or some patient that they haven't uterus, they have an egg, but there is no uterus. So for this patient, somebody must carry these babies.
Yes, and that's called surrogacy.
Yes. But
Surrogate mother.
Yes, here in the Bosnia it's forbidden. In many countries.
But do you know in which countries
it's...
it's...
some problem for the patient to stop it, you cannot. They are going to somewhere else. And
Well, okay, it just makes it more expensive and more complicated for couples.
Stress. Not in their country. When I started this job, actually at that period, every month we had a 50 case from the ex-Yugoslavia. In the Universal Hospital, every month I had a 50 case. They are coming there and they are doing the IVF in the Istanbul. So if we have a problem with also these kind of, from here going to the other country, mostly going to the Czech Republic for these, to do these things.
Yes, because there you can also have surrogate mothers,
Yes, in the Czech Republic, in the Cyprus, in the, EV, in the Spain.
Spain and where else?
Yes, Spain.
EV, what did you say?
Yes, EV. Mostly they are going for the EV in the Spain. And as I said, in the Turkey
I think in
also.
United States also.
In the United States also they have it, but in the United States they're expensive. So they are not going one cycle is 25,000.
Yes, exactly. But let's go back to people. Do men actually nowadays accept that there can be problem by them, not only by a woman?
Yeah,
because in the past, it was a big taboo for men.
Yes.
They didn't even want to go to the check.
Yeah. Generally, when we are talking about the infertility, everybody is finger the woman. Because of your problem. But actually, 35% of the cases because of the man problem. Just
35%.
35% only for the woman, and around 20% is there. A little problem with the man, a little problem with the woman, but 10% actually we don't know what is the problem exactly. But 35% of this just from the problem with the man.
Yeah.
Because from the education, from the from the sperm quality, now the libido is very low actually.
So how is big libido influencing male fertility? Is it good if he ejaculates a lot, or is it bad?
Actually, sometimes
Does it influence at all?
Yeah, that's something that I always think. Normally, if they are ejaculating every day, sperm quality is getting poor. It's better every 2-3 days, because sperm is living in the body around 3 to 5 days. But when they are ejaculating more frequently, it's making problem. Or abstinence. For example, some patient is thinking that, okay, I will wait until the ovulation. At that day, we will have an intercourse, so I have a more chance for this. No. At that time, sperm quality is not good because motility, sperm is losing the energy, losing the fragmentation starting in the sperm. And they are not good for this. So to wait too much is not good for. Every day is not good. It's better every 2-3 days.
So if you're planning normal pregnancy, you should wait 2 or 3 days.
Yeah. Near the ovulation days, every 2-3 days to have an intercourse. This is more successful for the patient. And they are getting more succeed than the patient.
Is there any more advice that you would give to the couples when they are trying to get baby before they come to you for the assistance?
Yeah, actually, this is the most important, is because first they are going for some doctors, and after them going to the gynecologist or going to the hematologist, I don't know, endocrinologist, and this. If they have a problem, it's better directly to go to the fertility specialist if they know that they have a problem. For example, if one lady haven't any menstrual cycle, or menstrual cycle is too painful, and it's for example, every 40 days, 50 days is coming. So there is a problem. Or for the man, if the volume of the sperm is very low, so don't lose the time with this. Immediately go to the doctor.
What do you say, very low?
For example, normally when the males are ejaculating, there is a volume of the ejaculation must be more than 1.4 milliliter. But some males, they are explaining, doctor, there is a little sperm. This means this man has a problem with the sperm production. Or if they are feeling something in the testicles, or there is this vein in the scrotum, or the testes are small, or as I said, the libido is low. For example, they don't want to have an intercourse. In this kind of the patient, it's better as soon as possible to go for the doctor. Or as I said, ladies that they have, for example, woman that said, I had an operation before because of the endometrium, I had an operation because of the appendix or something. This patient is better as soon as possible to go for them. If there's no problem, generally, we are preparing, if they prefer to say to patient, for example, if it's under the 35, for 1 year to try naturally, if there's no problem. But if it is over the 35, after 6 months, if something is not happening, is not going to the pregnancy, it's better to check with the one fertility specialist to see what's the situation, how is the ovary, how is the sperm. After then, according to this, to decide what to do.
Yeah. Any advice for women when they want to get pregnant normally?
Normally, generally nowadays they are tracking this menstrual period with these apps.
Sure.
They are checking for these apps. Okay, today is the ovulation day, and they are making more stress for themselves, and they are waiting also.
Does alcohol harm? Does smoking harm? Does stress make it difficult?
Healthy life is, of course, is good for everything, for the reproduction, for our life, everything. I cannot say that it's a one glass of the alcohol or to drink 2 coffee per day can affect the fertility. No, absolutely it's not like this. But if it's always drunk and is drinking alcohol from the morning until the evening,
Yeah, of course.
This is not good.
For example, in the past, we used to think that maybe some children diseases affect infertility. Is it still the same, like zauške, like some disease in the young age can provoke infertility in male?
You mean in the man or?
In the man.
In the man, yes. For example, mumps. When they are a child, if they have a mumps,
Da, to su zauške.
yes, this is affecting them. Also, sometimes in the childhood, they have a testis up. They are doing the operation for this. This is also affecting them.
Yeah, but is there a terminal infertility, like that you cannot help? And why is that?
Actually, nowadays, everybody can have a baby.
Yeah?
With the donation, with the surrogacy, somehow they can have a baby. But with the own egg and sperm, sometimes it's difficult in these kind of the countries.
Why?
Because you cannot do the donation, you cannot do the surrogacy, so it's difficult in this country. But in the other countries, no.
No, and they don't have prejudice maybe that much, because I think people are hesitating to take the donation because of some of their beliefs.
Yeah,
They don't want to have other person's genes.
Yeah. For example, in some country, sperm donation is forbidden. In some country, egg donation is forbidden because of the religions, because of the things, because of this. But generally, when they are doing this donation, actually, yes, genetically is not their baby.
But how many percent does the surrogate mother bring? Actually, if you donate, if you take a donated egg or a donated sperm, you are some kind of surrogate.
Yes.
you yourself, and you get your baby.
Another part is from the husband. So somehow there is a little connection with the family. Part of this is 50% is from husband.
Yes.
Okay. And genetics of but epigenetics of also we have epigenetic. Epigenetics is affecting the life of the baby.
So epigenetics of the mother.
Yeah, epigenetics of the mother is also affecting, because just is not a chromosome that inside the epigenetics also affecting. After that, they're adapting for this.
What is exactly epigenetics, to say for those who don't understand?
Epigenetics is that some genes in our body, outside our chromosome. For example, in the mitochondria, in the other part of we have a different genes.
In our cells.
Yes. These are also affecting with the, normally, when there is these genes, these are also affecting the growth of the embryo, the implantation, everything can affect this. But
for inheriting some characteristics, that's what I meant.
Yeah, not exactly characteristics. When we want to do the egg donation, generally we are looking for phenotype of the patient. We are trying to find somebody that's phenotypically
similar.
Simple.
You mean when it is similar to?
Similar to,
like black hair?
Yeah, black hair, skin, blood group, everything. We are trying to find this.
So you know the blood, depending on the blood group of the donator.
Of the patient, we are trying to the skin the same, the hair, I don't know, eyes, a little similar to.
Yes.
We cannot do, for example, to the one lady that's from the Turkey to do the donation from the Russia. And it's totally different. So we are trying to do this. After that, when we are selecting this patient that's suitable for this donor, we are arranging for the egg retrieving and this. But these are, as I said, these are forbidden here, so I don't want to talk.
So here you cannot choose.
No, we are not.
Oh, well, here you don't have even the banks.
No. here
because it is not allowed.
Yes, it is not
yes, to donate. Oh, sure. But what you were explaining is in the countries where it is legal.
They have a donation centers.
In Serbia, we have donation centers, but
Yes,
I think we have a problem with the donors. My last information is that there were not enough donors, but I'm not quite sure. So maybe it changed.
Yeah, actually.
Do you think people in the Balkans hesitate to be donors?
No, economically, generally, in the economically a little low economically countries, they are more donating the egg. For example, as I know, many students is going for the egg donation. They are doing the stimulation for 1 month. They are earning some money. Okay, that's good for them. But there is some rules that we have to check with this.
Yes. Anyway, one more important question. Sometimes two people are fertile, but they cannot conceive. So did you have experience or that you know that when people changed partners, because in life that happens usually, they try for 5 times, for 10 times, and they cannot make it, although everything seems okay. But then when they change partners, everything...
Both of them are the best.
Yes. Yeah. So why is that?
Actually, as I said, many factors is there. Sometimes, I don't know, psychologically or something, they are not. But in the laboratory, sometimes we can find, for example, when we are doing the microinjection, these eggs are not growing, or this is a fertilization failure. There is many things with it. But when they are changing their partner, easily they are getting pregnant. For example, for a young lady, she has a good potential for the pregnancy. When she's married with the old man, okay, easily they can get pregnant. Or when the ladies are old, for the man that is, if it is young also, the possibility is low. But of course, more than the husband that she had an older one.
So bigger possibility when the partner the man is younger than a woman.
Yeah.
Like a lot younger, like she is 45 and
the possibility is good because in the old also they haven't regular intercourse, they haven't normal life.
Yeah. But how much does their relationship affect? Like if they are having a good relationship, if they understand each other, if they have a loving relationship, or if they have a toxic relationship, a lot of jealousy. Or
it's the intercourse is going if they are a problem in their life. Actually, there is no any intercourse between them. Their sexual intercourse is going. Everything is emotionally is not prepared for this. Psychologically is not. So it's making a problem. As I said, for example, in the Japan now.
In Japan,
in Japan, there is an interesting thing that couples. They don't have an intercourse that they are going for the IVF because of the psychological, because of the job, because I don't know what's the stress or something.
So they prefer going to IVF than
to IVF to have a baby to don't have a sex.
Really?
Yeah. So
who doesn't want, men or women?
Generally, men.
So they are not gay, they don't like sex.
Yes.
And probably here it is not allowed, but maybe sometimes a gay friend with his girlfriend, they decide to have children.
LGBTs in the United States, if you check for the website, first thing is the LGBTs. Yes, they can make a baby with the donor eggs, everything, but here no. Here just we have to do the baby from the
Is
couples.
here only from married people or also like fiance?
No.
Just married.
Here's the regulation is just they have to be married. If they are not married, or they have to bring some paper from the municipality to say that they are living together for a long time or something.
Okay. Okay, and Turkey? Is Turkey liberal?
Turkey, no. More
Because you
strict than here.
yeah.
Yeah.
Because you used to work there for
Yeah,
quite a long time, so
In Turkey, it's
so
more
okay.
strict. So because of this, when we started in the Universal Hospital, actually for the donation, for some patient need surrogacy, for some patient need the sperm donation. So for these in Turkey is not allowed. So most of the clinics started to open the donation center in the Cyprus of the part of the Turkey. So now they
In
have
the Turkish
all,
part of Cyprus, you mean?
yes,
So there you can.
all the clinics from Turkey, they have a
Their
clinic
centers.
over there that's a sister clinic. They are making these donations,
Okay.
sperm donation, surrogacy, or sex selection.
Oh, yeah. That's also one ethical
Yes,
question.
because of some countries, for them, the sex selection is not ethic. But in the United States, when we are talking about family balancing,
Yeah.
family man, for example, one
They have-
couple have a fourth girl and they want to have one boy. Okay, why you don't do this? Okay, we can do this. This is
But you
family
only know
balancing.
that when you have embryo. You cannot know
We are retrieving it.
Yeah, so
We are retrieving it. We are making the embryo. We are making the biopsy from the embryo and selecting the gender of the embryo, and we are doing the transfer.
So, yeah.
it's good. But here,
so the embryo itself shows
yeah,
shows the gender.
yeah.
Once the baby is made, it is in the uterus.
Okay.
So what kind of analysis do you do? What is now the latest scientific research?
For the
baby, for
generally
mother?
If you mean that after when they get the pregnant, you mean after
Yes,
the
yes. When once the IVF is successful,
and succeed,
and now the baby is growing in
actually
the
we are
stomach.
using some hormones. We are checking for these levels of the hormones in the bloodstream to see how is their levels. If they are good, okay, to continue with the same doses. When they are coming in around 7 weeks, 8 weeks, we have to check for torch infection to see torch infection is good or not. One of the most torch infection, toxoplasma, rubella, some cytomegalovirus that they can affect the health of the baby. We are checking for these hormones. We are checking also for some thyroid function because it can make a abortion or something. These hormones are important. And also we are checking for the liver and kidney because when we are using these medications, sometimes it's harmful for the liver, kidney. We are checking for this.
But when people conceive naturally, they don't have to worry about all these.
No. When it's naturally, thanks God.
Yes, thanks God. Well, okay, Dr. Ali, thank you very much for this interview.
Thank you.
Thank you very much.
Male stvari.